Hello students, this is Dr. Manjunatha working as an assistant professor in sociology in SMG of GC Kabahalli, which is located in the district of Chamarajnagar. In this video, I am going to discuss about the introduction of medical sociology. So here, this is regarding with reference to chapter number 1 in the subject of medical sociology. So here you will be going to learn about what is medical sociology and how the medical sociology was originated, and so particularly how it is relevant to the current society, how people are going to perceive the medical sociology per se. So this session's topic is medical sociology introduction. Here you can see that there is a major development in the history of study of health and disease, which is growing recognition in the relevance of social determinants. In the medical sociology, social determinants are very, very important. Social determinants are nothing but they are going to be having such kind of impact on the people's lives or health conditions. So, social determinants of health refers to social practices and conditions. For example, lifestyle, living or working conditions have impact on the health conditions of the people. Now, currently, you can see many developed countries are seeing a large number of cases of diseases which are related to their lifestyles. For example, obesity. There are some countries where developing countries or underdeveloped countries where we can see the malnutrition exists. So in that kind of countries you can see there is some kind of social practices or aspects where that is having an impact on the people. So nowadays in the modern society, people are being or just they want more about they want more luxurious life. So in that kind of condition, what will happen? People will be prone to many diseases due to non-exercises or some kind of aspects. So here social determinants not only foster illness and disability, they also enhance prospects for coping with or preventing disease and maintaining health. So that is the fundamental theme of medical sociology. So in this medical sociology, we as a medical sociologist think that social determinants play significant role. Hence, medical sociology deals with the certain aspects. Particularly, there are many branches in the sociology. So same with the medical sociology. So medical sociology is the new emerging branch which is very significant while dealing with these health aspects, particularly in the pandemic. Now we are facing coronavirus pandemic. In this kind of pandemic, we can see that there are a large number of cultural aspects also involved while combating coronavirus. There are many countries which have succeeded in combating this pandemic, and there are many countries which have not at all took care of it. So cultural aspects, social practices, lifestyles also have an influence on health. Earlier people used to think that health was only it's a condition, medical condition, but it's not only about medical condition, but also there are certain aspects involved: social, cultural, emotional and other aspects where the WHO has given a definition which will be dealt in the another session. ಸೊ ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ಈ ಸೆಷನ್ನಲ್ಲಿ ನೀವು ಮೆಡಿಕಲ್ ಸೋಷಿಯಾಲಜಿಯ ಅರ್ಥ, ಮೆಡಿಕಲ್ ಸೋಷಿಯಾಲಜಿ ಹುಟ್ಟಿದ ಅಥವಾ ಆರಿಜಿನ್ನ ಒಂದು ಹಿಸ್ಟರಿಯನ್ನು ಮಾತ್ರ ನೀವು ಈ ಒಂದು ವಿಡಿಯೋದಲ್ಲಿ ಕಲಿತೀರ. So medical sociology, what is medical sociology? Medical sociology is the sociological analysis of medical organizations and institutions, the production of knowledge and selection of methods, and the actions and interactions of healthcare professionals, and social, cultural, medical practices. So we study all these aspects in this medical sociology. This is very, very important. The field commonly interacts with the sociology of knowledge, science and technological studies, and social epistemology. So it is a kind of interdisciplinary approach where we can see that interdisciplinary approach means a particular study has some kind of large branches of knowledge where we use all branches of knowledge to study. So here this medical sociology has some kind of borrowing from other fields like medical aspects and social psychology and etc. So here medical sociologists are also interested in the qualitative experiences of patients, often working at the boundaries of public health, social work, demography, and other aspects also we are interested. Health disparities commonly relate to typical categories of class and race and caste and etc. So the people who receive health benefits or some kind of, they will be going to some hospitals and getting treatment and all, is determined by the social category or social position a person has in a stratified society. But as an example of Indian society, so in Indian society is a most stratified society. We can see there are large number of stratifications: race on the basis of color, class on the basis of money or wealth, caste on the basis of social hierarchy. In India, according to G.S. Gurye, there are 3,200 castes and subcastes. So all these castes are being hierarchized. So there is an hierarchy where we can see that some castes are upper and some castes are lower. So getting the health benefits also is based on caste system sometimes. So it caste plays a significant role in all the sectors, politics or some kind of economy or many aspects. So same with the medical field also. So here it's an example where you can see that social determinant has an impact on obtaining health services. So here you can see that if the field of medical sociology is usually taught as a part of wider sociology, as already I told you. So what is exactly the medical sociology? Medical sociology is simply the study of effects of social and cultural factors on health. So here you have to see that medical sociology is a study of effects of social and cultural factors on health. ಈ ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರ ಎಂಬುದು ಏನು ಅಂತ ಹೇಳಿದ್ರೆ, ಪ್ರಮುಖವಾಗಿ ಈ ಸಾಮಾಜಿಕ ಮತ್ತು ಸಾಂಸ್ಕೃತಿಕ ಅಂಶಗಳು ಈ ಒಂದು ಹೆಲ್ತ್, ಆರೋಗ್ಯದ ಮೇಲೆ ಯಾವ ರೀತಿಯಾದಂತಹ ಪರಿಣಾಮವನ್ನು ಬೀರುತ್ತವೆ ಅನ್ನುವಂಥದ್ದನ್ನು ನಾವು ಈ ಒಂದು ಮೆಡಿಕಲ್ ಸೋಷಿಯಾಲಜಿ ಅಥವಾ ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರದಲ್ಲಿ ಚರ್ಚಿಸ್ತೇವೆ. ಇದು ಪ್ರಮುಖವಾದಂಥದ್ದು. ಏನು ಅಂದರೆ ಸಾಮಾಜಿಕ ಮತ್ತು ಸಾಂಸ್ಕೃತಿಕ ಅಂಶಗಳು ಹೇಗೆ ಒಬ್ಬ ವ್ಯಕ್ತಿಯ ಆರೋಗ್ಯದ ಮೇಲೆ ಪರಿಣಾಮವನ್ನು ಬೀರ್ತವೆ, ಆ ವ್ಯಕ್ತಿ ಯಾವ ರೀತಿ ಆ ಒಂದು ಆರೋಗ್ಯದ ಅಥವಾ ಅವನು ಅನಾರೋಗ್ಯದ ಪರಿಸ್ಥಿತಿಯಲ್ಲಿದ್ದಾಗ ಈ ಆರೋಗ್ಯದ ಸೇವೆಗಳನ್ನು ಪಡೆದುಕೊಳ್ಳುವ ಸಂದರ್ಭದಲ್ಲಿ ಅಥವಾ ಅವನಿಗೆ ಸಿಗುವಂತಹ ಒಂದು ಅವಕಾಶಗಳ ಮೇಲೆ ಈ ಒಂದು ಸಾಮಾಜಿಕ ಆರ್ಥಿಕ ಅಂಶಗಳು ಸಾಂಸ್ಕೃತಿಕ ಅಂಶಗಳು ಯಾವ ರೀತಿಯಾದಂತಹ ಪರಿಣಾಮವನ್ನು ಬೀರ್ತವೆ ಅನ್ನುವಂಥದ್ದನ್ನು ನೋಡುವಂಥದ್ದೇ ಈ ಒಂದು ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರದ ಒಂದು ಗುರಿ. ಮೆಡಿಕಲ್ ಸೋಷಿಯಾಲಜಿಸ್ಟ್ಸ್ they help individuals view the healthcare system as a function of society and serve it by as a stepping stone towards greater career opportunities also. We can see that. So medical sociology involves large number of things. It's a sociological analysis. It's nothing but actually you have to understand medical sociology is a part of sociology. So there are large number of branches. they out of all these things, it's a sociological analysis of various aspects. What are these aspects? You have to see medical organizations and institutions. So medical sociology studies about medical organizations and ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸ್. ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರವು ಪ್ರಮುಖವಾಗಿ ಈ ವೈದ್ಯಕೀಯ ಸಂಘಟನೆಗಳನ್ನು ಮತ್ತು ಸಂಸ್ಥೆಗಳನ್ನು ಅಧ್ಯಯನ ಮಾಡುತ್ತೆ. ಸೆಕೆಂಡ್ಲಿ, ಮೆಡಿಕಲ್ ಸೋಷಿಯಾಲಜಿ ಸ್ಟಡೀಸ್ ಅಬೌಟ್ ದ ಪ್ರೊಡಕ್ಷನ್ ಆಫ್ ನಾಲೆಡ್ಜ್ ಆ್ಯಂಡ್ ಸೆಲೆಕ್ಷನ್ ಆಫ್ ಮೆಥಡ್ಸ್. ಈ ಒಂದು ಜ್ಞಾನದ ಉತ್ಪಾದನೆ ಮತ್ತು ಯಾವ ರೀತಿಯಾದಂತಹ ವಿಧಾನಗಳನ್ನು ಬಳಸ್ತಾರೆ ಅನ್ನುವಂಥದ್ದು ಕೂಡ ಅಧ್ಯಯನ ಮಾಡುತ್ತೆ. ಮುಂದುವರೆದು ಈ medical sociology, this medical sociology studies about the actions and interactions of healthcare systems. That is also very important. And finally, medical sociology studies about the social and cultural effects of medical practice on the people. This is very, very, very important. That is the medical sociological aspects. So far, I have discussed about what is medical sociology. Now let us move on to emergence of medical sociology, where it was emerged. So primarily you can see that earlier in the beginning, maybe in 1900s and all, so the earliest works in medical sociology was undertaken by physicians, not by sociologists, because on that time sociologists tended to ignore this field, and because sociology was emerging field, as you all know, in 1830s sociology was emerged. So in that time they didn't bother about studying medical sociology at all, because they were studying there are the urban problems and industrializational problems, so that kind of stuff in earlier. Hence medical sociology was largely ignored by the sociologists, and they were studied by physicians. And later on, particularly in 1900s and all, early work in medical sociology was conducted by Lawrence J. Henderson, whose theoretical interests in the work of Wilfred Pareto so inspired Talcott Parsons. So here we can see that Talcott Parsons is the major person in the emergence of medical sociology. Talcott Parsons is also called father of medical sociology. So Parsons is a great person in this medical sociology. He comes up with sociological systems theory. So in the medical sociology, he applied that theory, particularly social role theory, to interactional relations between sick people and others. So he has a theory of this one social interactions theory. So he tries to apply that theory into the interactions between sick people and the others. Talcott Parsons is the person who came up with the concept of sick role also, where the people who have to undergo treatment and they have to perform certain roles. So he comes with a concept of sick role also. So you should remember about the Talcott Parsons, who has contributed on the medical sociology. Before that, Wilfred Pareto. Pareto also brought some kind of significant aspects about the studying of medical sociology, so which all inspired Talcott Parsons. There were many key contributors to the medical sociology since 1950s. The Howard Becker also studied medical sociology and contributed in large, along with Howard S. Baker, Mike Burry, Peter Conard, Jock Douglas, David Silverman, and others also. They contributed to the medical sociology. So first time where medical sociology was emerged, it's interesting to know that in Britain medical sociology was emerged. That is very important. The field of medical sociology is usually taught as part of wider sociology. This is very, very important. Clinical psychology or health studies degree in many universities and all. So now you can see that it's an optional subject in various universities and all. So it is also offered in degree courses and masters also. In 1944, the medical sociology was come up in UK, United Kingdom. So there was a report, good enough report in 1944. In that one, it was mentioned that social explanations of medical diseases meant for some doctors a redirection of medical thought from purely clinical and psychological aspects to social aspects. So the introduction of social factors into medical explanation was most strongly, where we can see that strongly evidence is there that community, where we can see the impact of community, particularly in a social medicine. There was a concept of social medicine, then later to general medicine also. So the term medical sociology, when it came, this is very important. ಈಗಾಗಲೇ ನಿಮಗೆ ಹೇಳಿರುವಂತೆ ಈ ಮೆಡಿಕಲ್ ಸೋಷಾಲಜಿ ಅನ್ನುವಂತಹ ಒಂದು ವಿಷಯ ಏನಿದೆ, ಮೊದಲ ಬಾರಿಗೆ ಈ ಒಂದು ಡಾಕ್ಟರ್ಸ್ ಅಥವಾ ಫಿಸಿಷಿಯನ್ಸ್ ಈ ಒಂದು ವಿಷಯದ ಬಗ್ಗೆ ಗಮನವನ್ನು ಹರಿಸ್ತಾ ಇದ್ರು. ಹಿಂದಿನ ಒಂದು ಸಂದರ್ಭದಲ್ಲಿ ಈ ಒಂದು ಸಮಾಜಶಾಸ್ತ್ರಜ್ಞರು ಮೆಡಿಕಲ್ ಸೋಷಾಲಜಿಯ ಕಡೆಗೆ ಗಮನವನ್ನು ಹರಿಸಿರಲಿಲ್ಲ. ಯಾಕೆ ಅಂತ ಹೇಳಿದ್ರೆ ಸಮಾಜಶಾಸ್ತ್ರ ಆಗ ತಾನೇ ಒಂದು ಉಗಮವಾದಂತಹ ಒಂದು ಪರಿಸ್ಥಿತಿ ಇತ್ತು. ಸೊ ಹಾಗಾಗಿ 1944ರಲ್ಲಿ ಮೊಟ್ಟ ಮೊದಲ ಬಾರಿಗೆ ಈ ಒಂದು ಮೆಡಿಕಲ್ ಸೋಷಾಲಜಿ ಅಥವಾ ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರ ಅನ್ನುವಂಥದ್ದು ಮೊಟ್ಟ ಮೊದಲ ಬಾರಿಗೆ ಬ್ರಿಟನ್ನಲ್ಲಿ ಪ್ರಾರಂಭ ಆಗುತ್ತೆ, ಗುಟೆನ್ಬರ್ಗ್ ಅನ್ನುವಂತಹ ಒಂದು ರಿಪೋರ್ಟಿನ ಆಧಾರದ ಮೇಲೆ. ಅದೇ ಥರ ಈ ಒಂದು ನಮ್ಮ ಒಂದು ಸಮಾಜಶಾಸ್ತ್ರದಲ್ಲಿ ಈ ಒಂದು ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರದ ಪಿತಾಮಹ ಎಂದು ಕರೆಸಿಕೊಳ್ಳುವಂತಹ ನಮ್ಮ ಈ ಒಂದು ವಿಲ್ಫ್ರೆಡ್ ಪ್ಯಾರೆಟೋರ್ ಅವರಿಂದ ಪ್ರಭಾವಿತರಾದಂತಹ ಒಬ್ಬ ವ್ಯಕ್ತಿ ಯಾರು ಅಂತ ಹೇಳಿದ್ರೆ ಟಾಲ್ಕಟ್ ಪಾರ್ಸನ್ಸ್ ಅವರು. ಸೊ ಟಾಲ್ಕಟ್ ಪಾರ್ಸನ್ಸ್ ಅವರನ್ನು ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರದ ಪಿತಾಮಹ ಎಂದೂ ಸಹ ಕರೆಯಲಾಗುತ್ತೆ. ಸೊ ಹಾಗೆ ಈ ಒಂದು ಮೆಡಿಕಲ್ ಸೋಷಾಲಜಿ ಎನ್ನುವಂತಹ ಪದವನ್ನು ಮೊಟ್ಟ ಮೊದಲ ಬಾರಿಗೆ 1894ರಲ್ಲಿ ಬಳಸ್ತಾರೆ. 1894ರಲ್ಲಿ ಯಾರು ಅಂತ ಹೇಳಿದ್ರೆ ಚಾರ್ಲ್ಸ್ ಮೆಕೆಂಟೈರ್ ಅನ್ನುವಂಥವ್ರು ಒಂದು ಆರ್ಟಿಕಲ್ನ ಬರೀತಾರೆ. ಆ ಆರ್ಟಿಕಲ್ನಲ್ಲಿ ಈ ಒಂದು ಸಾಮಾಜಿಕ ಅಂಶಗಳ ಮಹತ್ವ ಈ ಒಂದು ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರದಲ್ಲಿ ಅಥವಾ ವೈದ್ಯಕೀಯ ರಂಗದಲ್ಲಿ ಹೇಗೆ ಕಾಣಿಸ್ಕೊಳ್ಳುತ್ತೆ, ಹೇಗಿದೆ ಅನ್ನುವಂಥದ್ರ ಬಗ್ಗೆ ಒಂದು ಆರ್ಟಿಕಲನ್ನು ಬರೆದು ಆ ಆರ್ಟಿಕಲ್ನಲ್ಲಿ ಮೊಟ್ಟ ಮೊದಲ ಬಾರಿಗೆ ಮೆಡಿಕಲ್ ಸೋಷಾಲಜಿ ಅನ್ನುವಂಥದ್ದನ್ನು 1894ರಲ್ಲಿ ಅದನ್ನು ಬಳಸ್ತಾರೆ. ಸೊ ಲೇಟರ್ ಆನ್ other early work by physicians also included. There were some essays and articles and journals and all. They were written on the relationship between medicine and medical relations and people and all those things. So there were some books also written, articles also were written on the field of medical sociology. So this is very important for the emergence of this medical sociology. Then later, after the Second World War also, this medical sociology has gained momentum, and there were some socio-medical researches which were available for the people to review also. Then there were some Chicago schools also. They also studied about medical sociology. Then later on, it's moved from Britain to US and UK and other France and other countries also. So then this attracted some international attention for the considered study about the mental disorder and social class, and so particularly about how social aspects are impacting on the medical sociology. So this is very important aspects. Then Frederick Engels also studied about capitalism and class and other things. So here they discussed about other aspects also. Durkheim, Marx, Weber, and other classical sociological significantly. So this is very important. So far, we have learned about the meaning of medical sociology as well as the emergence of medical sociology. So, let me conclude this session by saying that medical sociology is a sociological analysis of how social factors influence health and disease of people in our society. ಈ ಒಂದು ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರವು ಪ್ರಮುಖವಾಗಿ ಈ ಸಮಾಜಶಾಸ್ತ್ರೀಯ ಒಂದು ದೃಷ್ಟಿಕೋನವಾಗಿದೆ. ಸಮಾಜಶಾಸ್ತ್ರೀಯ ದೃಷ್ಟಿಕೋನ ಏನು ಮಾಡುತ್ತೆ ಇದರಲ್ಲಿ ಪ್ರಮುಖವಾಗಿ ಅಂತ ಹೇಳಿದ್ರೆ ಸಾಮಾಜಿಕ ಮತ್ತು ಸಾಂಸ್ಕೃತಿಕ ಅಂಶಗಳು ಹೇಗೆ ಒಂದು ಹೆಲ್ತಿನ ಮೇಲೆ, ಆರೋಗ್ಯದ ಮೇಲೆ ಪರಿಣಾಮವನ್ನು ಬೀರುತ್ತೆ ಅನ್ನುವಂಥದ್ದನ್ನು ನಾವು ಅಧ್ಯಯನ ಮಾಡುವಂಥದ್ದೇ ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರವಾಗಿದೆ. ಸೊ ಇಲ್ಲಿ ನೀವು ನೋಡೋದಂದರೆ ಹಿಯರ್ ಯು ಕ್ಯಾನ್ ಸಿ ದಟ್ ದ ಮೆಥಡಾಲಜೀಸ್ ಆ್ಯಂಡ್ ರಿಸರ್ಚ್ ಇನ್ ದ ಫೀಲ್ಡ್ ಆಫ್ ಮೆಡಿಕಲ್ ಸೋಶಾಲಜಿ ಆರ್ ಕಂಡಕ್ಟೆಡ್ ಇನ್ ದ ಲೈನ್ಸ್ ಆಫ್ ಸೋಶಾಲಜಿ ಇಟ್ಸ್. ದ ಮೆಥಡ್ಸ್, ಈ ಒಂದು ವೈದ್ಯಕೀಯ ಸಮಾಜಶಾಸ್ತ್ರದಲ್ಲಿ ಮಾಡುವಂತಹ ಸಂಶೋಧನೆ ಯಾವ ಒಂದು ಹಾದಿಯಲ್ಲಿ ಸಾಗುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ಸಮಾಜಶಾಸ್ತ್ರದ ಒಂದು ಹಾದಿಯಲ್ಲೇ ಸಾಗುತ್ತೆ. ಇಲ್ಲಿ ಬೇಕಾಗಿರುವಂತಹ ಒಂದು ವಿಧಾನಗಳು, ಸಂಶೋಧನಾ ವಿಧಾನಗಳು ಏನಿದೆ ಇವುಗಳನ್ನು ನಾವು ಎಲ್ಲಿಂದ ಬಾರೋ ಮಾಡ್ಕೊಳ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರೆ ಈ ಒಂದು ಸಮಾಜಶಾಸ್ತ್ರದ ಒಂದು ವಿಷಯದಿಂದಲೇ ಬಾರೋ ಮಾಡ್ಕೊಳ್ತೀವಿ. So, medical sociology in India is being recognized as a major field with general sociology. Even in India also it is emerging now, where you can see that proper growth of medical sociology in India will definitely benefit both general sociology as well as public in this particular pandemic. And I can suggest you certain books also are written by Hannah Brandy. It's written by Hannah. Title is Medical Sociology, an Introduction. So it's a Sage publication which was published in 2009 for your reference. And Sarah Nettleton has written The Sociology of Health and Illness, which was published in 2013, where you can also go for your reference with other on the aspects also. William Cockerham also has written a book on medical sociology, which was published in 2016. And a very important one new book has come. The title is The New Blackwell Companion to Medical Sociology, edited by William C. Cockerham, which was published in 2010. Thank you for watching this video.